support Congresswoman Johnson, how would you achieve universal health care over the next 2 years?
Well, I have been working with the cities in my district using what we call HRSA grants to be able to reach out and cover the homeless. Remember, I'm the one that introduced the federal legislation that covered all children in America with health insurance, and in Connecticut is called Husky. And I've enriched the senior program called Medicare with the first preventive benefits under the Republicans and prescription drugs now. But that's not all. We have also put into Medicare a chronic disease management plan that will help seniors who suffer from chronic illnesses to have far better preventive and holistic care. So we've set the pattern of enriching benefits in a way that improve quality, but will reduce costs because they will reduce usage of hospitals and emergency rooms. And if we can get the uninsured into the system, as we will through these HRSA grants, and into electronic health records, we will learn what we need to do from the federal level to make sure that all Americans have access to affordable health insurance that is funded honestly and does truly give them a choice of doctor. Medicaid is no longer funded honestly by the state. It doesn't give you a choice of doctor because it pays so little that very few doctors participate. As chairman of the Health Committee, he could have taken that on. As chairman of the committee that governs Medicare, I have taken on the payment issues to make sure people get paid fairly and equitably, but I'm swinging the whole plan around to a preventive, holistic, supported kind of plan that will improve quality and save money. And when we do national health care, we need to put in place that kind of holistic, preventive health care system for everyone.
Chris Murphy.
Thank you. You know, what's lost in government today, I think, is this old word called accountability. And there's got to be some accountability in this Congress for where our healthcare system has gone. It's well and good to talk about 17 different proposals, which maybe in the end get us somewhere close to insuring more people. But let's be honest, the number of uninsured are going in only one direction. We aren't getting closer to universal health care coverage on any single day. Every day we get farther away. And why is that? Because this Congress has put profits before people. And the Medicare prescription drug benefit is a perfect example of it. Congresswoman Johnson certainly rightly takes credit for writing that bill. But what it did was basically do everything that the insurance companies and drug companies wanted. In the end, costing us 3 times more than it was initially estimated to cost. Now estimated to cost $1.2 trillion from the original $400 billion. Why aren't we getting closer to universal health care coverage, despite the fact that we are paying exponentially more in this country than other countries for health care? Because our health care system is designed to help the people who are making money off of it, not the people who should be benefiting from it, patients. And Congresswoman Johnson has a lot to answer for. During her time as chairwoman of the Ways and Means Subcommittee on Health, she's had an opportunity to start righting the ship. But by every indicator, by every measure, our healthcare system is getting worse. Less businesses able to offer insurance to their employees, more people uninsured, and costs rising. I'm committed to a system of universal coverage that uses the bulk purchasing power of the federal government to achieve those savings, that starts to pool resources to allow small businesses to buy in to some of the big federal programs, and first decides to put patients and their well-being ahead of the profits of the industries that are now making out far too well off of this system.